Hello my precious friends, I really hope that you're doing great. Welcome to today's class. It's our 6th lesson on scientific investigation. So today we are looking at a very critical component within our laboratory, which is called the first aid kit. Now the first aid kit is essential as far as treatment to medical emergencies within our laboratories are concerned. Now all laboratories should have what we call a first aid kit. So let's look at the key components that an ideal first aid kit must contain. So the first aid kit should contain the following. One, we have what we call an instruction manual. So what is the function or the role of an instruction manual within the first aid kit of a given laboratory? So an instruction manual simply gives us what we call a general guidance for treating a wide range of injuries and illnesses before a professional medical help. So before we take the victim or the patient to a physician or a doctor, we are supposed to follow the instructional manual so that to help the patient to be ready to meet the doctor or the physician in case the injury, of course, is critical. Now, the second component that an ideal first aid kit must have is what we call individually wrapped sterile adhesive wound dressing. Now, remember the word sterile simply means a material that is free, from the microorganisms, a material that is free from microorganisms causing infections, microorganisms causing infections, such as, so the microorganisms that usually cause infections, one, we have the bacteria, we have the virus, and lastly, we have what we call the fungi. So that is what we mean by the word sterile. So a material that is free from microorganisms causing infections, such as bacteria, a virus, and fungi. So an individually wrapped sterile adhesive wound dressing is very critical in the first aid kit. So it has to be in a variety of sizes so as to protect wounds from infections, stop bleeding, absorb any discharge, and of course promote the healing process by creating a clean and secure barrier. Then the same sterile adhesive wound dressing, they are also used for the minor cuts, the scrapes. Now the scrapes, what do we mean by a scrape? So scrapes are simply wounds that are caused by rubbing or dragging the skin against hard surfaces such as road, pavement, or even walls. Also, the scrapes also involves the outer layer of the skin being worn out. So the sterile adhesive wound dressing, they are also used for minor cuts, scrapes, and also blisters. Now, blisters are simply small bubble-like elevations of the skin filled with clotted blood, pus, or what we call a clear serum. So a blister is simply a small bubble-like elevation of the skin filled with clotted blood, pus, or clear serum. So the sterile adhesive wound dressing, they are used for minor cuts, scrapes, blisters, keeping them clean while preventing bacteria from entering this particular wound, or preventing what we call the microorganisms, the living microorganisms causing infections, such as the bacteria, fungi, and also the virus. Now, the third component of a first aid kit within the laboratory is what we call the safety pins. Their function, they are used for fastening bandages or slings in a first aid emergency. Remember, when you fasten the bandages or slings, you can prevent things such as further damage to the wound, and also you can also use it to control further bleeding of that particular wound. So safety pins are very essential for fastening the bandages and slings in a first aid emergency. Now, the fourth component of our first aid kit is what we call the sterile iPads. We said that the word sterile simply means free from living microorganisms causing infections such as the fungi, bacteria, and of course the virus. So sterile eye pads to protect, cushion, and cover an eye injury wound, also absorb any discharge and prevent further infections into our eye. Then the fifth component of a first aid kit is what we call a triangular bandage. That is, triangular bandages, they are used to create slings for supporting injuries, that is injured limbs, apply pressure to the injured wounds to control bleeding. So that is the function of triangular bandages. They can use to control bleeding whenever they apply some pressure on the injured wounds. Now, the sixth component of a first aid kit is what we call a bottle that contains the eye drops. So remember, eye drops are used to drop individual drops of important medicine, that is the eye medicine within our injured eye. So a bottle that contains eye drops for dispensing small drops or for removing small drops of liquid medicines into the eye to flush out foreign objects. Remember, when we talk of foreign objects within the eye, could include some dust particles. Those are what we are calling the foreign objects, and any other object that will impede with the proper functioning of the eye. So we need an eye drop to dispense small drops of liquid medicine into our eye to flush out any foreign objects such as the dust. Now, the seventh component of our first aid kit is what we call a first aid manual. So the function of first aid manual is to provide clear step-by-step or systematic instructions on how to handle medical emergencies and injuries that could occur within a laboratory. Now, the eighth component of our first aid kit is what we call a pair of scissors, which are used for trimming and cutting bandages and other wound dressing to access and treat the wounds easily. So when you use a pair of scissors, they can use to trim or to reduce the size of a bandage or cut the bandage so that whoever wants to perform the first aid can easily access those particular wounds for medical attention. Now, the ninth component of our first aid kit is what we call the gloves, which act as the PPE. Remember, PPE simply means personal. This is personal protective equipment. The personal protective equipment. Those are what you're calling the PPEs. So the gloves act as the personal protective equipment to create a barrier against germs and body fluids, that is protecting the first aider from infections, of course, from the wound, from the person who has been, who is suffering from that particular wound. So the gloves, we usually wear them on our hands. So the function is to protect whoever is performing the first aid, or what we are calling the first aider, from acquiring infections from that particular wound that the person is treating. Remember, the wound could contain some microorganisms, the living microorganisms causing infection, such as the bacteria, fungi, or virus. So the gloves will protect whoever is treating the first, that is the patient, from acquiring those particular infections. Then the last component of our first aid kit is what we call an antiseptic. Now, an antiseptic is simply a substance applied to living tissues such as the skin or wound to kill or inhibit the growth of living microorganisms causing infections such as bacteria, virus, and fungi, of course, to prevent infection. So the function of an antiseptic is to clean wounds, kill the germs on the skin around the injuries, that is to prevent infections and initiate the healing process. Of course, once you prevent infections, you are able to initiate the healing process. A good example of an antiseptic that is found in the laboratory is what we call the hydrogen peroxide. So this one, you can use it to clean the wounds, kill the germs, and of course prevent infections, and hence initiating the healing process. Thank you very much for accompanying me until the end of this particular lesson. I do not take it for granted. In case you're new to the channel, kindly hit the subscription button and also turn on the notification bell so that whenever I upload a new video, you'll get notified. Until next time, this is Kind Tuition Academy. Thank you very much.